Well, first COVID, then hair loss. Doctors say more people are recovering from COVID, who are recovering from COVID, start losing their hair about 2 to 3 months after they're infected.
Yeah, that's right. Dr. Michael Wolfeld is a board-certified plastic surgeon and hair loss specialist based in New York City, and he's joining us with some ways to get hair to grow back. Doctor, thanks so much for joining us.
Thank you for having me.
Well, let's jump in first of all. What causes people to lose their hair after getting infected with COVID, and then how long does that last as a result?
Sure. So COVID by itself is not causing the hair loss, but the stress to your body, and we refer to it as telogen effluvium, is what's triggering the shedding of hair. So usually you would see it a month, 2 months, or 3 months after you've had COVID. And it could last up to about 6 months.
Wow.
So it really can happen. But the good news is that the hair does grow back eventually.
So you mentioned the stressors can cause you to lose the hair. Is there anything else that causes people to lose excessive amount of hair?
Sure. So in terms of a shedding of hair, any stressor such as an emotional or psychological stressor, recent surgery, childbirth, crash diets, new medications, anything that changes or that's a stress on your body can potentially trigger a shedding.
All right, let's talk about it so people don't get too scared. But talk about normal hair loss, what that looks like, and when that's a problem versus a real problem.
Yeah, so normally people shed 50 to 100 hairs a day. That's normal. You may see it in the shower, you may see it on your brush, and that's normal. It's when it's really excessive and it's almost coming out in clumps and you're seeing it much more in the shower. That's where it could be this telogen effluvium, this shedding process, and that's where you may want to come in and see a specialist.
So doctor, what can people do to kind of minimize the shedding or help their hair regrow faster?
Sure. So a lot of times it's waiting it out, but also a good nutrition, a good diet high in iron and vitamins can be very beneficial. If you have any constant stressor, you can modify that. Potentially that can help a lot. So anything that, if you can modify your diet and modify the stressors, can be beneficial for regrowing your hair.
Definitely always comes back to diet and stress, doesn't it? But there's one more thing, genetics. They can play a big role in this. Or what are some of the ways to battle hereditary hair loss?
Sure. So that's a different type of hair loss, and that's where your hair gradually thins over time. You could see it in men and women. And there are medications, there are treatments that can help to thicken your hair and slow this down. There's different medications for men or women. And if it is progressed and it does bother you, there's also surgical treatments such as hair transplant procedures that can be beneficial.
I know, we were kind of zoned in looking at the video of the transplant surgery.
Wow.
So interesting. Well, thank you, Dr. Wolfeld, for joining us.
Thank you very much for having me. I appreciate it.
Have a great day.
All right. Well, the Harlem